Okay, let's talk about the vascular supply to the scapular sling muscles. And as we do, we're going to answer a few questions like what arteries supply the scapular sling muscles? How does blood get from the heart to the scapular sling? What is collateral circulation? And what are the boundaries and branches of the axillary artery? To get started, we're actually going to draw a diagram of the vascular supply. For me, I think the best way to learn the arteries is to practice drawing them. And if you can draw them out, then you know them. So to get started on our diagram here, I'm just going to draw this as the heart. We're just going to draw the word heart. So that's going to be our heart. And then for the arteries, we know from the heart, we're going to have the aorta. So there's an aortic arch there. So we'll just draw an A for the aorta. And then we actually have some asymmetry going on. And so what ends up happening on the right side, we have this guy here. And this is the right brachiocephalic artery. So I'm just going to write RBC for right brachiocephalic. And that name is telling us it's going to the brachium, so the upper limb. And then cephalic, that it's going to go to the head as well eventually. Off of the left aorta, the left portion, we're going to have the left common carotid artery that's just going straight to the head. And then we're going to have the left subclavian artery right there. A little bit of asymmetry. The reason for that is the aorta tends to be a little bit more on the left side. So these branches just come directly off the aorta. To get to the right side, we have to do the right brachiocephalic. And then from the right brachiocephalic, we will have the right common carotid artery that's going to the head. And then from there, we will have the right subclavian artery right there. And so the right subclavian, it gets its name, it's below the clavicle. And this is going to have some important branches that we want to talk about for the upper limb. On the right subclavian artery, there's a vertebral artery that eventually goes to the brain. We're going to kind of skip that one from now. There's an internal thoracic, which is supplying like the anterior chest. So we're not going to talk about that one too much. We're just going to put it for completion. But then we have what we're going to call the thyrocervical trunk. So maybe I'll write this out because it's kind of a longer name. So thyrocervical trunk. So what we've got going on. That's going to take up some space. We'll see how the rest of this image goes. But the reason it gets its name is there's a branch off of that trunk that goes to the thyroid gland. And then the other portion of that trunk, a lot of it's supplying the cervical region in the neck. So ends up being a pretty good name for it. The couple branches we're going to see, the first one coming off of it is going to be the suprascapular artery. So we know we have a suprascapular nerve that goes to supraspinatus and infraspinatus. This suprascapular artery runs with that nerve to also supply those muscles. So suprascapular artery. And then also off of that trunk, as we continue, there is a transverse cervical artery. So transverse cervical artery, and that has two branches. One of those branches, we'll draw it here, the dorsal scapular artery. So we also had a dorsal scapular nerve that went to the rhomboids and the levator scapulae. The dorsal scapular artery going to the rhomboids as well. Finally, to finish off this thyrocervical trunk, there is a superficial branch. So I'm just going to write superficial branch of the transverse cervical artery right here. And that is going to go and supply the trapezius muscle. And that is it for the branches we're going to talk about from the subclavian artery. So again, the ones that are important for the upper limb, the thyrocervical trunk has a suprascapular artery, a dorsal scapular artery, and then a superficial branch of the transverse cervical artery. And then as we continue our drawing of the right subclavian, I'll maybe continue with this here. The right subclavian eventually is going to hit this landmark. So I'll kind of draw it right here. So this is going to be the first rib. And so the subclavian artery, it hits the first rib, and then once it gets to kind of the lateral border of that rib, it's the same tube, but we're going to change name. So instead of being the subclavian, this portion I'm now drawing here, we're going to call the axillary artery. So maybe I'll write that over here. So we've now switched from subclavian to the axillary artery. And the axillary artery, it's going to have three portions is how we're going to divide it. The first portion has one branch. The second portion has two branches. The third portion has three branches directly off of it. So the first branch off of the axillary artery, we'll draw that right here. And that is the supreme thoracic artery. So a great name, very official. The supreme thoracic artery is just going to kind of the upper portion of the thorax, ends up getting some of like the pectoralis muscles while it's there. So supreme thoracic is the first portion. And maybe I'm just going to draw a little divider. So we've got the first portion, and this will now be the second part of the axillary artery. And so this part is going to have two branches. The first branch we're going to see, we have another trunk. And this trunk is going to be supplying the thorax and the acromial area. So we're going to call this the thoracoacromial trunk. And so we'll draw kind of a line out here. Maybe we'll switch to black for the label. So we'll get this. We're calling this the thoracoacromial trunk right there. So we've learned two trunks, kind of similar names. There's a thyrocervical in the neck for the thyroid and the cervical region. Here off the axillary, we have the thoracoacromial trunk that's supplying the thorax and the acromial area. And this is going to have four branches. One of the branches off of this thoracoacromial trunk goes to the pecs. So we're just going to call that the pectoral artery. And there's usually a couple different branches of that. So a few pectoral arteries. There is also an acromial artery, which makes sense. Acromian's in the name of the trunk, so there's an acromial artery. There is a clavicular artery or a couple clavicular arteries. And then the fourth branch, there's also a deltoid or a couple deltoid arteries. That is the thoracoacromial trunk. And then the other part for the second portion here of the axillary artery, the second branch on the second portion, we're going to call that the lateral thoracic artery. So lateral thoracic. This one's kind of unique. Usually nerves and arteries that run together get the same name. This artery, the lateral thoracic, is running with the long thoracic nerve. So those are going to both go and supply the serratus anterior. And then to finish up the axillary artery, we're going to now go to the third portion. So we'll just draw a little 3 here. So it should have 3 branches. The first branch that we're going to see is the subscapular artery. So we'll go subscapular. We had a suprascapular artery up here. Now we have the one that's below, so the subscapular artery. And this has 2 branches off of it. So one is going to go back kind of the way that it's coming here. So I'm going to swing this kind of almost back behind the axillary. And we're going to call it the circumflex scapular artery. And we'll see that on an image a little bit later. Whenever we see the word circumflex in anatomy, it just means it's wrapping around something. So the circumflex scapular artery is going to wrap back around the scapula. And then the other branch goes to the latissimus dorsi. And we know the nerve that goes to latissimus dorsi is the thoracodorsal nerve. And so we're going to give this artery the same name. So that's going to be the thoracodorsal artery right there. And then so that just counts as one branch off of that third portion with the subscapular. And then the other 2 branches, I'm going to lengthen our axillary just a little bit. The other 2 branches are going to actually swing around the humerus. So maybe I'll kind of try to draw a little humerus, something like this right here. We're a little too far away from the artery for my liking, but that's what we'll go with. So the next branch we're going to see is a posterior circumflex humeral artery. So that name's just telling us it's circumflex, it's wrapping around the humerus on the posterior side. So we'll swing that. And then it's just going to be wrapping around the posterior neck. And then the other branch that we're going to see is the anterior circumflex humeral. So that's going to go anteriorly around the humerus, and those actually meet up and connect. So I'll maybe label those. So posterior circumflex humeral, anterior circumflex humeral. And then for the axillary artery, we're going to have that same tube continue, but once it crosses the border of teres major, so maybe I'll draw this, will be kind of like a little teres major right here. Ooh, something like that. So once the axillary artery crosses that inferior border of teres major, we now rename it and it becomes the brachial artery right there. And so this, now looking at it, it just seems like a total mess on this image, not the greatest drawing ever. We'll go and see some actual images now. But the one thing before we switch, I think drawing out the arteries like this is phenomenal. I know I said it at the beginning, but I'm just going to repeat it again. Great way to practice and really get the arteries down is to draw them something like this. Okay, so we'll switch to this image and see what these arteries actually look like. And so the first one we're going to go over is the subclavian artery branches. So here we've got the clavicle, and we can see the subclavian artery here kind of hanging out below the clavicle. And so this branch, this would be the common carotid artery going to the head. So I mean, this was the right brachiocephalic, and then it's switching to subclavian right here once those 2 branch. So subclavian artery, we kind of just briefly mentioned this, I'll mention it again. Vertebral artery here, supplying the head. We've got the internal thoracic. And then that means this guy here, this trunk, would have to be the thyrocervical trunk. And then the branches we talked about, one, the suprascapular artery going to supply the same muscle supplied by the suprascapular nerve. And then another branch we see right here, we're going to call that the transverse cervical artery. And that gives off 2 branches. One, the dorsal scapular artery that runs with the dorsal scapular nerve. And then the second branch is the superficial branch of the transverse cervical artery, and that's going to go and supply the trapezius muscle. And then once the subclavian artery hits this border of the first rib, this lateral border, we're now going to change the name from subclavian artery to axillary artery, so we will move to that next. On this new image, we now see a little bit more for the axillary artery, and just to ID, here it is, it's past or more distal to that inferior edge of the first rib. And then the first branch of the axillary artery we're going to see is the supreme thoracic artery. And then in the second portion, we're going to see 2 branches. One is the thoracoacromial trunk here. And we know that has 4 different branches. This image is only showing 3. The first one going to the pectoral muscle, so we're going to call that a pectoral artery. The next one we got on this image going to the acromion of the scapula, so we're going to call that an acromial artery. And then this other branch we're seeing is the deltoid artery right there. So the one that's not pictured is the clavicular artery. And then the other branch in the second portion is going to serratus anterior. We call that the lateral thoracic artery. Again, different name than the nerve. So the nerve is the long thoracic nerve, artery, lateral thoracic artery. One way to remember the arteries in the second portion, there's a little mnemonic. It's Thor has packed lats. So Thor for thoracoacromial, packed spelled P-A-C, which we don't have the clavicular, and then D, and then lats for lateral thoracic artery. And then moving to the third portion of the axillary artery, we have the subscapular artery because it's below the scapula, and that gives off 2 branches. One is this circumflex scapular artery heading back towards and up to the scapula. The second is the branch going to this large muscle here, latissimus dorsi, and that is the thoracodorsal artery right there. And then the other 2, the final branches off of the axillary artery, are these ones that wrap around the surgical neck of the humerus. So we have a posterior circumflex artery right there, and then that's going to meet up with the anterior circumflex artery. And one note on these circumflex arteries, you'll notice that they are connected. And so whenever this happens in the body, we call it collateral circulation, where there's 2 different arteries that connect and they have 2 different sources or different areas they're coming from. This is typically a good thing because say maybe the anterior circumflex artery gets blocked somewhere, well then the posterior circumflex artery can pick up the slack and supply to wherever that area that's blocked. And since we're talking about the axillary artery, I just really wanted to quickly define what the axilla is. So the axilla is the anatomical space that is inferior to the shoulder. So you can basically think of this as the armpit for the most part. So the borders anteriorly is the pec minor and pec major. Posteriorly is latissimus dorsi and teres major. Laterally is the humerus and coracobrachialis. And then medially would be like serratus anterior and the first 4 ribs. So basically the armpit is the axilla, and it carries a lot of the brachial plexus as well as the axillary artery. So to finish up with the scapula vascular supply, we've got a posterior view here. We see the spine of the scapula, and we see a lot of these branches that we've gone over. So the ones we're going to start with, the suprascapular artery, again coming off of that thyrocervical trunk. That swings over, the nerve goes under this ligament, the artery goes superior to it, and you see it supplies supraspinatus, and then it swings down to also supply infraspinatus. The next one we're seeing off of the axillary artery, we see the subscapular artery. We know one of the branches there is the circumflex scapular artery. That runs through the triangular space, and then it's going to be here to supply infraspinatus as well as a little bit of supraspinatus. And again, we're seeing some of that collateral circulation. Also off of the subscapular artery is the thoracodorsal artery. And I don't love this image because primarily there would be a main branch going to latissimus dorsi, but this is another branch that would swing off of that supplies teres major off of the inferior angle of the scapula. And then you'll see that the thoracodorsal artery is meeting up with this guy. So to figure out what that is, we can see the transverse cervical artery here off of the thyrocervical trunk. And then we know one of the branches of the transverse cervical artery is the dorsal scapular artery right here. So dorsal scapular artery hanging out on the medial border of the scapula. The dorsal scapular nerve would also be right here. And then just to finish up, also off of transverse cervical, we have the superficial branch that goes to trapezius. All right, with all that said, let's do a quick review of these arteries and the supplied structure. So from the subclavian artery, we have the thyrocervical trunk. Some of the branches there, one is the suprascapular artery that supplies the supraspinatus and infraspinatus. We also see the transverse cervical artery, which has a superficial branch that goes to trapezius. Also has a dorsal scapular artery that goes to the rhomboids. And then once we hit the first rib, that lateral border, we now switch to the axillary artery. The first branch of that is the supreme thoracic. It goes to the pecs. Then the next portion, we see the thoracoacromial trunk. That has a pectoral artery going to the pectoral muscles, has an acromial artery that gets the deltoid, a clavicular artery that gets subclavius, and then a deltoid artery, which, of course, by its name, it's going to get the deltoid. So again, that's the PACD, the pact. And then we also have the lateral thoracic artery that goes to serratus anterior. And then off of the third portion, we have the subscapular artery with a couple branches. The circumflex scapular artery goes to the triangular space to get to infraspinatus, teres major, and teres minor. And then the thoracodorsal artery gets latissimus dorsi, like the nerve that it's named with. And then it also is going to send branches to serratus anterior and teres major. And then finally, we have the circumflex humeral artery. So the posterior circumflex humeral gets the deltoid, triceps, and teres minor. The anterior circumflex humeral is going to supply the deltoid, biceps, since we're now anterior, and then the coracobrachialis. And that is it for this video on the vascular supply to the scapular sling muscles.